Right, as we get into autumn and winter, things get colder, coughs and sneezes and diseases and whatever seem to get much worse, and then this variant of COVID, are we going to be struck with that again over the winter months? So the government's preparing the health service for the winter flu season. Yes, let's speak to the Health Minister, Maria Caulfield. Good morning to you, Maria. We understand the Prime Minister is hosting this winter round table today. Tell us more.
Yeah, no, absolutely. So this year we're starting earlier than ever to get our winter preparedness underway. We know that every year that winter is a challenging time for the NHS and social care because people naturally get more unwell with respiratory illnesses, with flu. We've had COVID in recent years, but also staff get sick as well. So that puts additional pressure on our services. So we're putting in our plans earlier than ever before with bringing forward our vaccination programme. So this week vaccinations are starting in our care homes already. Next week they'll be open to the over 65s and vulnerable people, and then the extra capacity we're building both in our hospitals but also in social care, so we're able to cope with any additional pressure that comes.
People will be reassured to hear that you are trying, but people are dying on waiting lists. I mean, the Prime Minister said this is one of his 5 ambitions, to try and bring them down, and yet more people died on waiting lists last year than not.
Well, we're actually making good progress on our waiting list. So while the numbers, overall numbers, are still high, what matters to patients is how long they're waiting on those lists. And we've actually eliminated the 2-year wait on lists. We now, in the last year, virtually eliminated people waiting for 18 months or more. So now it's tackling the year-long waits. And so we are getting through those pretty rapidly in terms of shortening the length of time people are waiting, whether it's for operations, procedures, scans, tests. And, you know, COVID, where we had to shut down the health system to routine care, has not helped with that backlog. But the measures we're putting in means that people are waiting a shorter amount of time, and we want to get that down further.
Well, how are you going to get that down further? I mean, we appreciate all the problems with COVID and whatever, but if you don't settle with the doctors, there'll be more strikes and there'll be more waiting lists, and there's nothing you're going to be able to do about that. How can you say to me you're getting the waiting lists down if the doctors continue to go on strike after strike?
Well, we're using a number of measures, and you are right, Eamon, that the strikes are not helping. We know that, to date, the strike action by doctors has caused by just under 1 million appointments to be missed, and that doesn't help us tackle our waiting list. And we've got further strike action to take. But we have been investing in our capacity building. You know, we've got rapid diagnostic units around the country now. I've got one in my own constituency, just at the edge, Falmer, where we're seeing millions of tests being done outside of hospitals, so biopsy, scans, other procedures. So we are increasing our capacity, but it is true that if we didn't have the strike action, we would be drastically reducing those waiting lists further.
Yeah, so what does all that mean? So anybody at all can carry out a diagnostic or a test as long as they're not a doctor. I mean, we can talk about this for ages, and you can take whatever shortcuts you want. End of the long and the short of it is, you've got to settle with the doctors. And it doesn't look as if it's going to remotely happen. It's inevitable. One day you will have to settle with the doctors. Why don't you just get on with it?
Well, we have put offers on the table. If you look at, for junior doctors, for example, we've offered 8 to 10%, depending on where a junior doctor is in their training. And that's comparable to the Scottish offer of 17% over 2 years, which the BMA have accepted. But unfortunately, they don't want to accept a similar deal in England. If you look with the consultants, not only have we offered 6%, which is just over £6,500 extra a year, but we've also dealt with the pension issue, which many of them felt were costing them money to come to work. So, you know, and that cost the taxpayer money to resolve as well. So we have moved on a number of pay issues, both for junior doctors and consultants, but they are both stuck at the 35% pay demand. And realistically, that's not something that we as a government or the taxpayer can afford. And it's not fair on other public sector workers, whether they're police officers or teachers or nurses, in fact, because that is not a demand that we can do across the board. And if we give it to one, it wouldn't be fair on the other public sector workers.
I want to ask you about another issue that our audience really cares about, and that is, of course, pensions. The front of the Eye this morning saying that the triple lock's under threat after the election, but the Express are questioning whether actually there could be a bit of a fiddle before even the election. And this is because we had those wage figures out yesterday, which put wages growth above inflation. And we know that's been bolstered by these one-off payments to public sector workers. And is there a possibility that you might actually try and make a saving there, and 12 million pensioners will miss out on what could be a nice boon for them in a cost of living crisis?
Well, you know, I'm slightly frustrated at the speculation every year about the triple lock. I mean, it was this government that brought in the triple lock because we understood the pressure that pensioners were facing. And every year we've kept the triple lock, and whether it's by wages or inflation or the 2.5%, whichever is higher, we have committed to that, and we delivered that last year when inflation was high. And we have said that the triple lock is safe, under this
tweak it after the
government.
pandemic.
We can't be clearer on that.
You have tweaked it in the past. It hasn't been untouched the whole time the Conservatives have been in power. So I'm just wondering, will there be another tweak, or can you rule that out this morning?
Well, the triple lock is safe under the Conservative government. And in addition to that, what we've done over the last couple of years is introduce extra winter fuel allowance for pensioners. So on average, the winter fuel allowance that pensioners get every year, we've added between £200 and £300, depending on whether you're a single individual or a couple. And we're doing that again this winter. And there have been additional funding announcements for pensioners during the cost of living crisis as well. So we have really put our money where our mouth is in supporting pensioners. And I can say to your viewers that the triple lock will be awarded this year, and the Conservatives will continue to deliver on the triple lock.
About spring next year, and I just want to get a guarantee from you that you won't be trying to use this loophole, which could bring it down to around 7.6%. It'd be a saving of 630 million for the government. I can understand why the Treasury might try and do that, but a lot of pensioners will be very worried about it.
Yeah, and I think the speculation doesn't help. If you look at our track record, not only did we introduce the triple lock, but we have delivered and kept the triple lock.
But will you keep it next year, next April?
That in the future. Well, I'm not going to comment on speculation.
Okay.
The triple lock will be kept next April. There's absolutely no doubt about that.